Why when I sneeze, my right nipple has transparent liquid coming out? I'm male. Nipple liquid, dropped organs, and Q-tips, good for you or bad for you? Today, we are back at it, breaking down and answering all of your juicy medical Discord questions. All right, let's dive right in. Why does it feel so good to put a Q-tip in your ear even though it's bad for you? Everybody has cerumen. Cerumen is earwax, and they actually will slowly make their way out. What ends up happening is when we use Q-tips, we can potentially compact it down in and cause a buildup of this earwax and cause compression onto the eardrum, and then you have issues where you feel like you're underwater or ear pain. You can get an infection that way. The other reason why we say be very careful with the Q-tip is you can cause a tympanic membrane or eardrum rupture, where you can actually pop it open, and that causes a significant amount of pain, can cause permanent damage to the eardrum itself. What could happen if I hold my pee forever? You would probably die. Your bladder starts getting distended. You're still making urine, so your kidneys are trying to push urine down while the bladder is not allowing the urine to kind of get out because it's just holding on to it. So now you're gonna have a backup. You're gonna start retaining and holding on to the electrolytes that your body's trying to excrete. Your kidneys are gonna shut down. You're gonna have buildup of electrolytes, and the ones we really worry about end up being your potassium and your sodium, and they can cause cardiac arrhythmias. A lot of different things that can occur. Is it possible to accidentally fart your intestines out? Yes. If you push too hard, you can basically involute the rectum the wrong direction and it can pop out. And I've actually had to put many of these back in. If you're having issues where you squeeze really hard, you can pop blood vessels out, you're not doing things right. You need to see your doctor. You need to, evaluate what you're eating, how your intestines are moving, that sort of thing, to make sure that you're not going to hurt yourself. Why when I sneeze, my right nipple has transparent liquid coming out? I'm male. This should get checked out. It could be related to an infection. It could be related to a medication, or it could be related to testosterone hormonal changes, or it could be related to cancer. Anytime you're having abnormal discharge from your nipple, male, female, you need to be evaluated by your doctor, and it needs to be evaluated ASAP. Don't let it wait. Don't be embarrassed. I always wondered what happens if a doctor drops accidentally an organ to the floor. If this does happen, you basically need to pick that organ up, clean it off. You can't necessarily sterilize it, right? Because you might kill the organ. Anybody who's having an organ transplant who needs this organ is probably going to be on antibiotics to cover any type of bacteria that might occur. In general, when you have an organ that is so precious, you're going to do everything you can to preserve it. So if it's still viable and you can use it, and the risk and the benefits are weighed and the benefits greatly outweigh the risk, you're still going to use it. Do you guys know anybody who's had a transplant? Let me know in the comments. Is it possible for one to penetrate the uterus during intercourse? It is extremely rare. A lot of times the most common reason we see a uterine rupture or penetration would typically be from pregnancies and previous scars to the uterus itself, and they might tear open. But if this issue does occur, it's quite dangerous because you could have significant amount of bleeding, not just pain. And the body will try to contract down because the uterus is a muscle to get everything to stop bleeding, but it needs to be evaluated by an OBGYN and most likely have surgery to sew that tear or puncture back up. Is it true that picking your nose causes dementia? There was some research that was done saying that there's a possibility of potential nose picking causing dementia. The study basically was on mice, not humans. Do we actually have the data that shows this? No, not specifically, but it just raises the question because everybody picks their nose, but not everybody gets dementia. It could be a risk factor, but not a direct cause per se, because there are multiple other different reasons why somebody might actually get dementia, and there are multiple different types. If you're using a gown in the ER, is it okay if you're in your underwear? Absolutely. The reason why we want somebody in the gown is we typically need to do a head-to-toe exam, especially in the emergency department. Typically what ends up happening is you will be instructed to keep your underwear on, put the gown on, make sure the gown goes on the front, open in the back, and it just makes everything a little bit easier. The gowns that we have at the hospital I work have buttons too on the arms, so you can actually just unbutton just to expose that area. What would happen if you ate lead? Here in the United States, any old home that used to use lead paint has to disclose that because high amounts and chronic amounts of lead could lead to mental delay, cognitive issues, chronic fatigue. We potentially are exposed to very small amounts of lead, but chronic higher doses of lead in our bodies are not good for us.
Sir, we have to evacuate the entire neighborhood. I need you to leave your house immediately.
Just so everybody knows out there, Literally, lead could also lower sperm count. Should I be worried if I'm 17 and haven't stopped growing? No, not necessarily. It has to do with growth plates most of the time and different hormonal changes. But say you continue to grow in your 20s and mid 20s, then you always worry about some other abnormal hormonal things that are going on. One of the things that you think about is basically acromegaly, like Andre the Giant, who, continued to grow and was just a massive man, and he did have a shortened lifespan. Most people, most boys hit their peak height at around 16, but you can continue to grow and still gain inches anywhere between up to 18 and 20 years of age. Why should you never mix alcohols together? Example, vodka and beer. I don't mean results. I've already found them out. I mean causes of results. Liquor before beer, you're in the clear, and then beer before liquor, you've never been sicker. Typically, it has to mixing. Some people are totally fine, other people are not, and it has to do with maybe the congeners, which are things within the products that might give you really bad hangovers. Clear versus colored liquors, that's part of the congeners. Also has to do with the hydration status. If you're having liquor, it could be just straight, or it could be mixed with mixers that are high in sugars, which could also lead to hangovers. And then instead of drinking water, you're following it up with beer. But at the end of the day, you need to just be aware, hey, let me just stick with one type of alcohol tonight. That would probably be your best bet. For all of you out there who can drink, let me know in the comments what your go-to hangover remedy is. I've been doing a lot of research and developing a product that potentially will help and make the next day after drinking so much better. I just wanted to drop a teaser on that because there's more to come later. Keep an eye out. One testicle is lower than the other. Why is that? And should I be worried? Don't be worried. That is 100% normal. Some it's the left, some it's the right. Doesn't really make that big of a difference, but typically the reason why is usually one testicle is a little bit larger than the other, which means that it's typically a little bit heavier, so it'll just hang a little bit lower. Plus, think about it. If they're sitting right next to each other, they're banging against each other, versus if they're just a little bit off, they fit a little bit more snug in there. Don't forget, make sure that you're doing self-exams, making sure that you're feeling for any abnormalities. Your testicles should be nice and smooth with the epididymis on the side, and making sure that you don't have any lumps, weird growths, any discomfort. Great questions, loved it. Love answering questions. Please continue to send them my way. And do you guys have any personal questions for me? Let me know. If I get a bunch of them, I will definitely do a future video answering those questions. Definitely check out this playlist right here. Just binge watch all of it. And as always, please make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.